I'm Madeline Pickens, and I interviewed my biology teacher's medical interventions class on February 15th. I interviewed Dr. Charles Sullivan on January 30th, and I interviewed Dr. Molly Martin on February 13th. It was in 8th grade when I discovered my love of science. Previously, I hadn't been that interested, but I had a really great teacher who really opened my eyes to the world of science and how intriguing it was. Once I got to high school, I was able to take some more specialized classes to really hone in on what area I liked, and it turned out to be medicine. I'm still not quite sure what area of medicine I want to go into, nor the scope or workplace or those aspects, but there were a few things that I ruled out pretty quickly. One of them was a surgeon. As a doctor, I really want to keep everything inside someone's body. I'd rather not be opening it up. I also didn't want to do a job that was purely research because then I wouldn't get to interact with patients at all, which is something I'm really interested in. The third thing I ruled out, which is more relevant to our conversation today, is I ruled out being a family medicine physician. The education wasn't an issue for me. The education for this career is fairly standard when it comes to medicine. You need to go to university, medical school, a couple of years in residency, and then possibly a fellowship. There are also plenty of tests and assessment that come with this, both some that everyone has to take and both some that are specific to different programs. Once you have all that done though, you can take a certification exam and start practicing. Within this path, there are a few other alternate options or add-ons, such as combination programs where you can study multiple areas, and you can also get additional certifications after you've gone through this process and you're a practicing doctor. The money also wasn't an issue for me. With an average salary of $231,000 plus $30,000 starting bonus, that's more than enough to pay for any debt and live comfortably. There are also loan repayments offered by employers as hiring benefits, and there are scholarships, especially for the medicine area, to prevent having debt in the first place. My issue with the job was that I thought that this job was mundane and that I'd be dealing with bad backs and sore throats the whole time. That is, until I met Dr. Charles Sullivan. This guy. He grew up on a ranch with animals and hence learned a lot about their biology. He also really liked to help other people, so combining these two things, this led him to medical school. In medical school, he had a few different area interests such as cardiology or emergency medicine, but he found that he really liked doing everything in the hospital, whether it was delivering babies, drawing blood, giving checkups. He liked all of it. He also wanted to build relationships with his patients and focus on the whole person, not just their lungs or their foot. He really loved his job being a family medicine physician. That's what most of our conversation was about. He really enjoyed delivering babies, as he told me many times, but he also really liked popping a bottle of champagne with a cancer survivor, or seeing his patients get better, or, even more than that, seeing his patients not get sick. There, of course, were some challenges that came with this job, such as the amount of time he had with patients, with so many patients and so few providers, the provider availability, which was already low, and the increasing amounts of paperwork he had to deal with as time went on. He did give me a lot of insight into this career, though, that I previously didn't know about, such as preventative medicine. He worked in the ER for some time, and he did find it too emotionally grueling, so he decided to work on things from the other end. For example, instead of treating someone who comes into the ER with an overdose, he wanted to help the patient before the overdose even happened through patient education, teaching healthy habits, mitigating risks, and so forth. I also learned how much physicians can impact their communities. Dr. Sullivan was one of the founders of our local pool and our local Boys and Girls Club, as well as an active volunteer at our local free clinic to help more people. He taught me about the role of family physicians in the healthcare world. He says that family physicians are almost like a guide for a patient, because right now, especially now, our healthcare world is really complicated and hard to navigate otherwise. You can help them on a basic level, but if you see they need something specialized that might be out of your area of expertise, you connect them with a specialist and monitor their progress the whole time. So you can be a point of connection, a point of communication, and keep in mind their whole body health while someone else is focusing on just this one specific issue. But my biggest issue was still the mundaneness that I perceived about the job. Though Dr. Sullivan told me that there is nothing mundane about this job. There is a different person with a different issue who walks through the door almost every hour. There's also a really broad scope that this career covers, which really keeps you busy and on your toes, having to keep up with all these different medicinal areas. It also can have a really big impact in the community. My previous doctor, Dr. Berry, actually became the Clallam County Health Officer right during the COVID-19 pandemic. And so her medical advice and recommendations were instrumental to our county surviving well during the pandemic. This career went from something I wasn't interested in to possibly one of my top 5 choices. There is a lot of burnout right now, and the need for family medicine is just increasing. So this could really help a lot of people. This career keeps you involved in so many medicinal areas, but also leaves you space to impact your community, social justice, and equity, which sounds really appealing to me as someone who wants to minor in political science. Realistically, medical school will help me find out what area I want to go in, but I may decide to specialize in everything and become a family medicine physician.